Hi, my name is Roger Lipe. I'd like to share with you, if I may, some of the things my wife and I experienced during her cancer battle, which began almost a year ago. Her first symptoms were in January of 2025 when she was experiencing shortness of breath. We went to the emergency room. They began a series of tests, as they always do in emergency rooms. And the normal things that one would think about related to shortness of breath were not true. It's not pneumonia. It's not anything else like that. And so they did a CT scan of her chest, still revealed nothing of note in the primary part of that. But at the very bottom of it, the ER doctor said, "There's something here I don't like. Let's get a CT scan of your abdomen." So when they did that, came back, saw the results, the doctor says, "This is what cancer looks like." We were obviously shocked, wondered, what does this mean? We soon learned what it meant, and we had a referral to a local oncologist. He immediately referred us to St. Louis to specialists who, that is their best thing, is gynecological oncology. And so we met with those folks. They put us immediately in the hospital. Sharon, the next day, had 17 pounds of fluid removed from her abdomen, where the cancer was causing all this fluid buildup among the metastatic tumors that were there. We soon started a chemotherapy process that included, in her case, 6-hour treatments. We did one of those after the chemo port had been put in to her chest. After a few weeks, there were complications as her chemo port had become infected. That infection led to damage on a heart valve. With that led to open heart surgery and the recovery from that, and then weeks of antibiotic infusions. Across all of that process, she got progressively weaker, wound up back in the hospital again, and then it was really hard. Um, Her cancer went untreated through all of that antibiotic treatment, dealing with the heart issue. Consequently, the metastatic cancer grew rapidly. We made a move from our home in Carbondale, Illinois to Jackson, Missouri, where our son lives with his family, just to be nearer them. And it was really good that we did that. Got there, started a new cancer treatment. We thought we're going to beat this thing. Let's keep going. But after that first treatment, she began to decline rapidly. It was getting worse quickly. We ultimately celebrated our 50th wedding anniversary in the hospital. Uh, Not the best circumstance, but we were thrilled to make it to 50 years. She went home for hospice care on a Thursday, and then Friday afternoon, June 27, June 27, Sharon passed away in our home, surrounded by her loving family. That was the right place to be. That was a tough 5.5 months, certainly the toughest 5.5 months of my life. It killed my bride. It was horrible. We were surrounded by our many friends and family in really simple and really profound ways, carried along by our faith, carried along by those that love us. Doctors and nurses who treated Sharon did the best they could with a really bad situation. They did really well. In particular, the hospice staff here in Southeast Missouri was stellar. The way they cared for us, gave us direct, clear information, really helped us prepare for the process of Sharon's final days. They were immensely helpful to us. This horrible, painful process actually drew us closer together as a couple as we battled together in those right down to the final moments of our life. Should you find yourself in similar circumstances as a patient or as a caregiver, battle that thing with everything you have in you. Don't shrink back from it. Deal with the thing head on. And as a caregiver, please do everything you can to be fully present, 100% engaged all the time you can. Uh, the days are fleeting and you can't get them back. So be there as much as you can. Do everything you can to clear your calendar, clear away any distractions, be there 100% in every way you can. He or she is worth it. Battle that thing, care deeply, love extravagantly.